Our window of opportunity is closing. If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. I'll never forget the emails I received from Mike Bowen and indicating that our mask supply or N95 respirator supply was completely decimated. And he said, we're in deep, the world is. That was our last window of opportunity to turn on that production. Normally it takes up to 10 years to make a vaccine. We've done it faster in emergency situations, but from when we had starting material in the freezer for Ebola. But for a novel virus, it's actually haven't been done yet that quickly. I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so. There was no action taken on the urgency to come up with a plan for acquisition of limited doses of remdesivir, nor to distribute those limited doses of remdesivir once we had the scientific data to support their use for people infected with this virus. I was told that my urgings were causing a commotion, and I was removed from those meetings. I believe part of the removal process for me was initiated because of a push back that I gave when they asked me to put in place an expanded access protocol that would make chloroquine more freely available to Americans that were not under the close supervision of a physician and may not even be confirmed to be infected with the coronavirus. However, my concerns were escalated when I learned that leadership in the Department of Health and Human Services were pushing to make that drug available outside of this emergency use authorization to flood New York and New Jersey with this drug, regardless of the EUA. And when I spoke outside of our government and shared my concerns for the American public, that I believe was the straw that broke the camel's back.
So people died because you weren't listened to?
People died because they didn't have appropriate protective equipment to save their lives and protect them from getting infected.
Anybody who wants a test can have a test. Is that true in the United States of America?
No. We still do not have a standard, centralized, coordinated plan to take our nation through this response. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership. I believe with proper leadership and collaboration across government, with the best science leading the way, we can devise a comprehensive strategy. We can devise a plan that includes all of Americans and help us guide us through this pandemic.